So, when to have surgery? It's an important question. Specifically in my world, I treat hip and knee arthritis and ultimately perform hip and knee replacement. I get that question a lot. When do I know it's time to have surgery? When do I know it's time to have hip or knee replacement? Well, it's individual. It's certainly a discussion you have to have with yourself, with your family, and certainly with your surgeon. But I think I can give you a couple of things, at least things that I see commonly, that'll help you kind of work through it. Ultimately, hip and knee replacement, the goal is to remove pain, right? To take away pain, which leads to better function and ultimately leads to a higher quality of life. If I had to pick one thing for you to focus on, it's quality of life. So with regard to your hip or knee disability, if it's due to hip or knee arthritis, ask yourself that one question. If you went without the hip or knee pain that you have from hip arthritis, how would that affect your quality of life? That may be the most important question to ask. But there are two things that often cause people to finally say, you know what, enough is enough. I can tell you one of those things is nighttime pain. When you start to have pain at night, the inability to sleep and rest well, things start to fall apart. The wheels start to come off. So nighttime pain and difficulty sleeping is a common thing that I hear as that straw that broke the camel's back to cause people to want to consider surgery. The other thing is the unpredictability of a joint, be it a hip or a knee. So even though arthritis most commonly is this wear and tear, slow process that happens over time, the truth is you'll have good days and you'll have bad days. And it's that unpredictability. It's not being able to trust or rely on the hip when you have an important vacation or important family event coming up. So it's the unpredictability, it's the nighttime pain. Ultimately, I want you to consider its quality of life. Now, there are important things to consider when you face surgery, and I want you to talk to your family and I want you to talk to your surgeon about the medical risks. But in truthfulness, it's an issue of quality of life. And when your life is so affected due to your hip or knee arthritis, hip and knee replacement is the only cure. Good luck.